Cambodia, a nation famous for its ancient civilization, but also its recent tumultuous history, is now looking toward a peaceful and sustainable future. Economic growth over the past decade has been around 8% a year, but the benefits of the economic boom are yet to be shared equitably. Cambodia's health system was completely destroyed by the Khmer Rouge. In places where health centres existed, there were no staff, equipment or patients. People had no trust in the health system.
In 1999, the Ministry of Health first contracted NGO to help to manage government health services in 5 remote districts. This was expanded to 11 districts in 2004, supported by the World Bank and Asian Development Bank.
Non-government organisations were contracted to help the weak government health system in remote areas to reach key primary health care performance objectives, be it good immunisation coverage or antenatal care. In remote Previhir, a province of 150,000 people, Health Unlimited was contracted to help to run primary health care. The Ministry of Health seconded 215 government staff, 12 health centres, 13 health posts and 1 referral hospital.
The contracting has improved staff motivation through salary incentive. The staff are happier and work full-time.
Staff also visit the community to provide immunisations, antenatal care and iron tablets. Cambodia is also known for its use of equity funds to help the poor access health services. Equity funds pay user fees on behalf of the poor and also the cost of transportation and food. Equity funds, usually managed by non-governmental organisations, also monitor the quality of care.
The 2005 Cambodian Demographic Health Survey showed that the health service have improved and were more successful. I see that contracting is very successful in delivering health services to population.
The new health strategy proposes to scale up contracting principles within the government to further improve health system performance, including independent monitoring and evaluation. The government also plans to scale up equity funds to reach more of the poor.
On the streets of Bangkok, primary healthcare may not seem much in evidence, but it was government policy for years in the 80s and has had a long-lasting impact. Almost 800,000 village health volunteers are trained as the front line against disease, and community action has proved instrumental in turning around a number of health threats, including HIV/AIDS. Now its supporters believe the primary healthcare strategy can be adapted to fight new health problems.
In the old days when primary healthcare was started, we are busy dealing with infectious diseases and some of the so-called diseases of the poverty. But Thailand has moved a long way after 30 years. They are now trying to make sure that the primary healthcare concept could also address the so-called new threat of health system, which is chronic diseases.
The gym at Sao Hai Hospital is part of the new primary healthcare front line. Trying to stem a rise in chronic diseases, the hospital runs workshops in healthy lifestyles and takes a holistic approach to its role.
ก็คือในวิสัยทัศน์เราเนี่ยจะมุ่งสู่สุขภาวะชนซึ่งเราก็อยากจะให้สุขภาพดีนั้นเราต้องทำเรื่องเกี่ยวกับ primary health care ให้ต่อเนื่องนะครับแล้วก็ให้มันยั่งยืนนะครับ
Appropriate treatment is one area of focus. Traditional massage sits alongside normal hospital procedures, and acupuncture is used for conditions where standard medical treatment has proved ineffective.
ในเรื่องของทางด้านร่างกายนะครับคนไข้เนี่ยครับก็มีการหายของโรคเร็วขึ้นภาวะแทรกซ้อนจากการรักษาเนี่ยน้อยลงนะครับการส่งต่อคนไข้น้อยลง
Another focus is to reach out to different sectors of society, from community volunteers helping patients to Buddhist monks visiting once a week.
ในชีวิตประจำวันของคนไทยทั่วไปเนี่ยก็มีการตักบาตรตอนเช้าอยู่แล้วถ้าเกิดเรานำพระเข้ามาในโรงพยาบาลเนี่ยเป็นการให้การดูแลด้านจิตใจหรือว่าด้านจิตวิญญาณนะครับ
Community action, however, remains the key. The hospital promotion teams visit nearby villages every week, working with patients and their families and encouraging local initiatives.
ก็มาเอาตัวเลขตอนนั้นมาเล่าให้ชุมชนฟังชุมชนเขาก็ตกใจเหมือนกันว่าชุมชนเราถ้าเกิดปล่อยเป็นอย่างนี้ไปเรื่อยๆเนี่ยก็มีแต่ต้องเสียค่าใช้จ่ายเรื่องการรักษาเนี่ยมากขึ้นในกลับมาทำงานในเรื่องของสุขภาพกับป้องกันโรคเนี่ยมากขึ้น
Community participation is important not only to influence the awareness or the knowledge of the people who are sick, but to make sure that the community environment is actually trying to induce the better understanding. It's a social movement, it's a community movement.
At a national level, initiatives like those in Sauhai are supported by a 2% tax on alcohol and cigarette sales, funneled into the Thai Health Promotion Foundation. Its strategy is to create practical ways to encourage community action on current issues.
Thai Health is a new approach to primary health care, and what we aim to do is to strengthen the Thai civil society. That's the principle, to empower the people and allow them to look after themselves. But the principle needs a practical delivery.
Back at Sauhai Hospital, the staff know their aim is to keep drug bills down and the patient numbers as low as they can, and they believe they know how to do it.
ผมว่าประเทศไทยโชคดีที่เรามีพระมหากษัตริย์นะครับซึ่งท่านได้บอกแนวทางแก้ไขปัญหาทุกปัญหารวมถึงปัญหาสุขภาพแล้วก็ในหลวงสอนเราว่าให้เรานั้นได้พึ่งตนเองไม่ว่าจะเป็นการออกกำลังกายหรือว่าเราใช้สิ่งที่มีอยู่ในประเทศเราทรัพยากรที่มีในประเทศเราจะแก้ปัญหาสุขภาพของเราได้โดยที่ไม่ใช่ความฝันแต่เป็นความจริง
This report has shown a few ways primary healthcare is responding to current issues. The health environment is changing, with globalisation, free trade and mass tourism bringing new disease patterns, intellectual property issues and a widening disparity between people around the world. Those who believe in the power of primary healthcare know it needs to continually adapt to meet the new challenges ahead.